Hello, my name is Jessica Troyer, and I'm a student at Eastern Michigan University. I am just finishing my bachelor's degree in nursing, and this project is for my capstone course. The project I chose is called Enhancing Communication Between Inpatient and Outpatient Care Managers, a Collaborative Care Approach. In this presentation, we'll briefly be discussing certain topics, including an introduction of concepts, the role of the inpatient care managers, the role of the outpatient care managers, collaboration of care, local resources, Spectrum Health resources. So, starting with introduction of concepts. Of the patients diagnosed with depression, an estimated 25% receive effective care and only 20% see a mental health specialist. Managing the increasing number of depressed patients requires the efforts of a fully integrated health system. Depression is associated with high health costs and loss of productivity for the patients that suffer from this ailment. Barriers to care persist, and they include inadequate prescription coverage, lack of access to counseling services, and lack of support from the patient's individual network. This has resulted in the development of evidence-based collaborative care, otherwise known as co-CM programs. These collaborative care management programs have been proven to work well in patient-centered medical homes as part of an integrated health system, and they improve the outcomes for depressed patients. The goal is to lower costs to the overall system by shifting care away from the emergency department and inpatient psychiatric units and into the hands of the outpatient care managers within the primary care setting. This is done with the use of a consulting psychiatrist. In this manner, the psychiatrist can see more patients with a streamlined approach from the care manager. So in this slide, we can see here that the treating physician is still the primary care physician, and the patient is in the center. The behavioral health care manager, which is part of the collaborative care training, is the liaison between the primary care physician and the consulting psychiatrist. The consulting psychiatrist does not have as much contact with the primary care provider or with the patient, but mostly directly with the behavioral health care manager. Again, this keeps the patient at the center of the plan of care and keeps the primary care physician in their role as oversight for the patient care. The ultimate goal is remission of depressive symptoms within 6 months, and this would be based on their PHQ-9s and their GAD scores in the office. The role of the inpatient care manager is to identify those patients who have a primary care provider already offering collaborative care management and place a call to that care manager on the outpatient side on admission to the hospital or the emergency department. This is so they can incorporate any existing plan of care. At the discharge from the hospital or emergency room, another call would be made to the care manager in the outpatient setting. The inpatient care manager would relay any changes to the plan of care, and if this patient is new to collaborative care management, provide a handoff to the primary care provider. Preventing frequent use of the emergency department, readmission to the hospital, and duplication of services is at the heart of care management services in general. The role of the behavioral health care manager is as the backbone for the model of co-care management. This is a cost-effective way to improve outcomes and quality of life for depressed patients. It fits well within the Triple Aim initiative, which improves quality of care while reducing costs and being population focused. By connecting the inpatient care managers to outpatient care managers through a handover both at admission and discharge from the inpatient setting, the plan of care can travel with the patient across the system. Again, the goals are to improve their patient outcomes, shift some of the burden from inpatient care management to outpatient care management so that inpatient care managers can really focus on medical issues that arise during their inpatient stay. And also hopefully lessen the use of the emergency room by, again, shifting the primary focus to the behavioral health care manager and trying to manage the patient's symptoms in the outpatient setting. Specific to my role in Berry County in working for Spectrum Health Pennock, Spectrum Health outpatient collaborative care management is offered through the primary care provider who would have to initiate the referral to a behavioral health specialist. In the outpatient setting locally, offices include Family Tree Medical, which is Dr. Carlson's office, Thornapple Valley Health, Dr. Ebaugh's office, Hastings Internal and Family Medicine, which is Dr. Parker and Dr. Asadorian, and Bright Start Pediatrics. And I have compiled a list of phone numbers and names of care managers that provide these services locally. These are a list of resources I used to prepare this presentation. And going forward, the Chief Nursing Officer here at Pennock, Steve Marzoff, has challenged me to not only expand this program, but expand into a coalition for care managers in Berry County, so that in general, for more than just depressed patients, we can collaborate from inpatient to outpatient setting and improve the lives of our patients locally. Thank you for listening.